A bombshell study released last week shows those previously infected with SARS-CoV-2 have natural immunity that offers 13 times more protection against the Delta variant than vaccination alone. The findings are from Tel Aviv. They followed over 700,000 people that were broken up into 3 different groups: those who were vaccinated with 2 doses of Pfizer, those who had recovered from a previous infection, and those who had recovered and received only 1 dose of the Pfizer vaccine. Now, the study found that those who had recovered from COVID were 13 times less likely to end up reinfected, concluding that natural immunity confers longer lasting and stronger protection against infection, symptomatic disease, and hospitalization. Now, though the researchers did see some increased benefit for those previously infected who also received 1 dose of the Pfizer vaccine, the researchers concluded the difference was statistically insignificant. So why would those who have natural immunity have a more robust immune response? The researchers hypothesize that it's because of B and T cell memory and the fact people who recovered from the virus are exposed to the entire virus, not just the spike protein the vaccines expose the body to. The study is yet to be peer-reviewed, but the findings are consistent with other studies and public health data. In July, the Israeli Health Ministry released data showing that of the nearly 850,000 Israelis known to have recovered from the virus, there were only 72 instances of reinfection, showing those with natural immunity were 6.5 times less likely to be affected by the Delta variant than those who were fully vaccinated. In May, the World Health Organization found that the immune systems of more than 95% of people who recovered from COVID-19 had durable memories of the virus that remained fairly stable over time, only declining modestly at 6 to 8 months after infection. Also, 6 studies, which encompass nearly 1 million people from Qatar to Denmark to the U.S. Marines, all found that the range of reduction of reinfection from COVID-19 was between 82% to 95% and found that naturally induced immunity resulted in extremely low rates of hospitalization and death in the event of repeat infection. Now, in the beginning, I said this was a bombshell study, but the reality is this shouldn't have been a bombshell at all. Conventional science has always held that previous infection results in robust immunity against reinfection from various viruses. However, for some strange politicized reason, for the past year and a half, this scientific fact has been hotly debated here in the U.S. But it wasn't always. In the instance of chickenpox, the CDC recommends vaccination for those who haven't had a previous infection. On their website, under the heading, "Who Needs a Chickenpox Vaccine?" the CDC says, quote, "People 13 years of age and older who have never had chickenpox or received chickenpox vaccine should get 2 doses at least 28 days apart," unquote. Same thing for the measles and even polio if they are not combined with other vaccines. Even during the smallpox outbreak, when vaccines became mandated, the certificate of immunity clearly gives clearance for those who had previously recovered from smallpox. So what's the difference now? Why suddenly, after over 100 years of recognizing previous infection as a robust form of immunity, are we suddenly rejecting science by forcing vaccines on absolutely everyone? Are public health officials just caving to the demands of a frightened public? Are they caving to the desires of greedy big pharma? In the European Union, where some countries have implemented vaccine passports, people can obtain one by either showing proof of vaccination, testing negative for the virus within 72 hours, or through proof of recovery from previous infection. This is based on sound science. So what is it that is causing this sudden rejection of widely accepted science here in the United States? We currently have colleges, corporations, big tech, politicians, and U.S. public health officials all openly excluding natural immunity as a basis for medical exemption. When recovered patients raise an eyebrow over policies mandated they be vaccinated, their educations, their livelihoods, and their ability to participate in society are threatened. Take, for example, Gianna Norris, a fiscal officer at Michigan State University. She recovered from COVID-19 late last year and has naturally acquired immunity. Now, even though she recently received 2 antibody tests that demonstrate her robust immunity from reinfection, the university is threatening disciplinary action and termination if she does not comply with the school's mandatory COVID-19 vaccination policy. Now, she's currently suing. At George Mason University, professor of law Todd Zywicki had fully recovered from COVID-19, but was also being threatened with termination if he did not comply with mandatory vaccination. Zywicki produced a statement from his own immunologist, who advised that it was medically unnecessary for him to get a vaccine based on the fact he had acquired natural immunity. Only after the professor filed a lawsuit did GMU finally come around to the science they have long previously accepted for other viruses. Then there are guys like Trump, Rand Paul, and Thomas Massie, whom after infection have claimed to be immune from COVID-19. Nonetheless, Twitter labeled Trump's claim to be in violation of their community guidelines and misleading. CNN, giving backing to Twitter's claim, pointed to the CDC's stance that there's no evidence people are immune to COVID if they've been reinfected. Again, completely antithetical to all previously known science regarding immunity, and even antithetical to their own stances listed on other areas of their website. Now, the study also brings into full focus a huge ethical question regarding our demand for mass vaccination of everyone, no matter their previous infection status. Should we be wasting vaccines on people who have stronger immunity than the vaccines alone can provide them when so many vulnerable people in the world haven't had a chance at a single dose? Why should greedy, rich Americans take 2 or even 3 unnecessary doses when poor countries aren't able to get enough for even their elderly population? Now, as we race towards 70 to 80% double and triple vaccinated in this country, most of the countries in Africa haven't been able to vaccinate even 2% of their total population. Now, if the entire point of the mass vaccination campaign is to get upwards of 70% of the population immune in order to stop variants from forming, then why are we not rushing to send extra vaccines to the very countries where the variants are emerging from? Places like India, where the Delta variant is thought to have originated, has only about 35% vaccinated. Peru, where the vaccine-resistant Lambda variant dominates, has about 30% vaccinated. South Africa has around 15%. Colombia is sitting at less than 45%. All of these percentages are just for one dose. Looking at full vaccination rates, and the percentages are much lower. Now, the CDC estimates that over a third of all Americans have recovered from COVID. A third. That means if the vaccines can even help us reach herd immunity, we only need 50% vaccinated to get us to a combined 80%. Now, currently, the U.S. is reporting just over 55% fully vaccinated, but it would be interesting to know how many of those were previously infected in order to give us a true picture of how close we are to this believed threshold for herd immunity. This would be important data for us to know in order for us to find out if herd immunity is even possible with this virus. Now, luckily, countries like Israel are keeping impeccable records. They have not politicized the virus, and they're able to give better insights into what's working and what isn't. Perhaps this recent study showing natural immunity to be the best protection will be the thing that finally changes our current line of thinking back to where it always has been. Now, no one is advocating for people to go out and purposefully catch the virus, but the reality is millions of people already have, and we can expect that many more will. And the people who have recovered have robust immunity that should be accepted, even studied by our society, as it always has, rather than shunned.